This is Dr. Sharma, maxillofacial prosthodontist, implantologist from Colonel's Dental Spa, Bangalore, India. A tooth after root canal treatment will require a crown to restore the function of the tooth, mastication, as well as aesthetics and speech also. But to fit a crown on the tooth, sufficient amount of tooth structure should be present so that the crown gets enough grip for retention. Sometimes because of the tooth decay or a fracture of a tooth, the tooth structure may not be sufficient for the crown to hold. In such cases, after root canal treatment, the tooth structure can be built up using a post-and-core. Now, a post is a restoration that is inserted into the root canal after root canal treatment for support, and then the tooth portion is built up around the remaining tooth structure and the post, which is actually called the core buildup. Now, the decision whether to do a post and core or to remove the tooth, depends upon the dentist and his and certain scientific guidelines. It is the decision taken by the dentist. It also depends upon how much load the tooth can bear. Now, posts are of several types, primarily prefabricated and custom made. Resin fiber reinforced posts are generally used for better strength, aesthetics, as well as durability. Once the core buildup has been done, a good ceramic crown is placed to restore the function of the tooth. At Colonel's Dental Spa, we specialize in all types of post and core buildup and always give the right opinion and decision to the patient for a better longevity of the work that we do.